And now NBC5 investigates questions about how prepared Illinois nursing homes were for an outbreak as devastating as the coronavirus.
Our team has found many of the facilities with deaths and illnesses were previously cited for infection control problems. Here's Katie Kim.
A worst-case scenario is happening inside nursing homes.
You have this vulnerable population living close together, engaging in congregate behavior, and the disease can spread dramatically.
And it has, nationwide and in Illinois. More than 1,000 people have died at long-term care facilities here from coronavirus complications. And that number is likely even higher since the state only releases its numbers once a week. The Illinois Department of Public Health has reported 351 facilities are facing outbreaks. NBC5 Investigates has found of those, 60% were cited for infection control violations in the latest report just released by the Centers for Medicare and Medicaid Services.
How important is infection control?
It's totally key, perhaps a warning sign of a facility that might be vulnerable to a bad outcome.
Dr. Ronald Hershow is an epidemiologist with the UIC School of Public Health.
If a facility was cited for an infection control violation, is it fair to say whether or not they were prepared to handle an outbreak like this?
It depends on what the specific violation was. Let's say inspecting the kitchen of a facility that would be less directly relevant to this respiratory virus.
IDPH Director Dr. Ngozi Ezike said the state is constantly communicating infection control practices and sending teams to facilities to urge compliance.
There could be laxes, and so, sometimes that is what is causing some of these outbreaks. Some is just that, with asymptomatic spread, it is very difficult to even know that someone potentially is spreading the virus.
And because of that, experts say just because a long-term care facility was cited for deficiencies does not mean it is more prone to a coronavirus outbreak. This virus has proven it is random and relentless. Rather, experts say the latest data shows there is much more work to do to protect those who are most vulnerable. Katie Kim, NBC5 Investigates.
The context is important. Our thanks to Katie.